Good morning. My name is Beth Beisel. I'm from Farmington, Connecticut. I'm an unpaid volunteer who helped Connecticut become the first state in the country to pass a GMO labeling law. That law was passed in June of 2013 by a vote of 134 to 3 in the House and unanimously in the Senate. Subsequently, it was preempted by the federal government, and Connecticut lost its right to require simply worded on-package GMO labeling. I'm here to ask you to reconsider spending $3 million taxpayer dollars to promote GMOs. But I also want you to think about your own families, your children and grandchildren and future generations. Most of us know someone with food allergies, autism, ADD, ADHD, digestive problems, or autoimmunity. In my testimony today, I will talk about my own experience as a health professional. My written testimony will include links to studies connecting these chronic illnesses to GMOs. My background is in nutrition. I'm a registered dietitian in private practice. But I'm also a mother, and I care deeply about providing the healthiest food possible to my family and making healthy food available for all Americans, not just the ones who can afford to buy organic. I'd like to tell you about some of my experiences with my clients who got better once they removed GMOs from their diets. One was a 20-year-old female with chronic stomach pain and dysmotility, who improved within 2 weeks of cutting GMOs out. Another middle-aged female had long-term constipation and chronic fatigue. She was already on a GMO-free diet, but we discovered that a vitamin she was taking contained a GMO corn derivative, calcium citrate. Once she switched it out for a non-GMO equivalent, she got better. By the way, over 90% of the corn in the United States is genetically engineered. Another was diagnosed with Hashimoto's autoimmune thyroidism, hypothyroidism, but after she removed all corn products from her gluten and dairy-free diet, her test results came back negative for antibodies to Hashimoto's, and her doctor was dumbfounded. In addition to working with private patients, I consult with a subacute care facility. I work with young and elderly adults in group homes, many of whom cannot speak for or grocery shop for themselves. And I work with severely autistic children in a residential school. In the last 15 years, shortly after GMOs were let into our food supply without our knowledge and without our consent, chronic diseases in children have been growing at an unprecedented rate. Diseases like celiac, diabetes, and autism are touching the lives of almost every community in America. 10 years ago, a CDC report estimated that severe food allergies affect 3 million children. While correlation does not equal causation, it can't be overlooked. Think about this for a second. When we were in school, how many children had to sit at allergen-free tables? How many children were on inhalers? How many children were autistic or had explosive disorders? How many children needed personal aides to monitor and assist them in school? When did you first hear the term autoimmune disease? Now, every school nurse's office has multiple inhalers, EpiPens, and psychiatric evaluation reports for children on psychotropic drugs like Ritalin and Adderall. This isn't happenstance. Something is going on. What has caused this epidemic of chronic disease in children? Could it be related to the fact that at least 40% of the population has some genetic mutation like MTHFR that inhibits their ability to detoxify? Has the introduction of GMOs and the pesticides they were created to withstand added to the toxic burden that these vulnerable children are faced with, resulting in a toxic load that is eventually too much to bear, so that suddenly, once that toxic threshold is reached, they are diagnosed with a chronic illness? Autism has grown at an alarming rate from 1 in 10,000 a few decades ago to 1 in 68 today. And it's not just because we've gotten better at diagnosing. There's a vast body of medical literature indicating that the increased rates of everything from autism to asthma are due to true increases in disease, not just better diagnosis or better patient capture. It is a real epidemic, and the rates of these disorders are increasing so quickly that the causes can't possibly be from genes alone. What about the economic costs of this exponential growth in childhood chronic disease? Should the short-term economic gains from selling cheap, fake food trump our health and future economic stability? Again, my written testimony provides studies that show a potential correlation between GMOs and the diseases I'm talking about. But I also want to stress the financial impact of these diseases on our economy. Autism costs the United States $268 billion a year, with a potential to reach $1 trillion by 2025. What we pay to manage autism in this country on an annual basis is more money than has been spent on the entire NASA program since 1971. Asthma, affecting 1 in 8 children, 1 in 6 African American children, costs the United States $56 billion per year. 1 in 5 children entering kindergarten carries a mental health diagnosis. The U.S. spends $83 billion a year on pediatric depression. So as the number of vulnerable children suffering from chronic illness multiplies, billions upon billions of dollars spent annually to care for them may break our nation. I see this firsthand in my residential school for autistic children. Many need 24-hour one-on-one supervision. This generation of children growing up in the United States is a threat to our economic and social stability. My whole point today is to ask you to consider that GMOs might be a part of the problem. They might be contributing to the toxic load I mentioned. So, it would be prudent to use the precautionary principle before allowing more of these questionable foods into our food supply. It is not prudent to promote them as safe and beneficial. There are no comprehensive, long-term, independent studies that prove that these patented, unique, genetically manipulated foods, which contain novel foreign proteins, are safe for long-term human consumption. The FDA has not done its own studies to prove that GMOs are safe. They rely on industry to do the studies to prove they're safe. The FDA says GMOs are substantially equivalent. Then why are they patented when a patent is supposed to be a claim on something that's unique and novel? Years ago, the FDA's safety policy included these words: ultimately, it is the food producer who is responsible for assuring safety. Yet, here's a quote from Monsanto's Director of Communications in 1988. Monsanto should not have to vouchsafe for the safety of biotech food. Our interest is in selling as much of it as possible. Assuring its safety is the FDA's job. The American Medical Association's policy states that GMOs should have pre-market testing before they hit the market. The Academy of Nutrition and Dietetics position statement in part says more research is needed to determine the impact on human and environmental health. We should let science prove safety through long-term, independent, peer-reviewed studies before we go promoting them with taxpayer money. Why not use the $3 million to do independent safety testing? Industry has spent well over $100 million to prevent GMO labeling and promote GMOs. They've done expensive political campaigns, first-rate public relations efforts, slick websites, and aggressive litigation. They fund front groups and operatives, hire well-connected lobbyists, and organize trade groups and social media campaigns. They attack scientific and journalistic critics. I'd like to end my testimony by reading a quote by Dr. Martha Hebert, a pediatric neurologist with a PhD as well from Harvard Medical School. We cannot maintain the illusion that one lives in a comfortable and rational world where new chemicals and technologies always mean progress, where experts are always objective and thorough, where corporations are honest, and where authorities can be trusted. That human actions, rather than genetics, might be responsible for compromising the health of a significant portion of a whole generation is unthinkable.
Thank you, Beth. Any questions? Clarifying questions from the panel?